Well, good evening, everybody. We're so glad that you're able to join us. We've got a great special guest. Dr. Ben Spitalnick is a pediatric specialist in Savannah, and he also happens to be one of the individuals who was so essential with us when we first started the Low Country Down Syndrome Society. And Ben actually knew my wife before she was my wife, and he was actually holding meetings in his office with families that had children with Down syndrome. And then he got on board and has been such an essential portion of our board and our officers. And we're just so thankful for you, Ben, and what you've done for us. And we're also thankful that tonight we have the ability to speak to Ben about this COVID situation, kids going back to school, testing. He's going to kind of go over the whole gamut. So, Dr. Ben?
John, thank you. And I'm just along for the ride, so I very much appreciate it. And I thank you for having me here tonight. And I hope I'm coming in clear. I'm always trying new devices. So it's back to school week for many, either this week or next week. And most families have either made up their mind or they're still in the process of deciding, should my child go to school live or should we go to school virtual, if that's the option? I mean, that's the magic question, John. That's what everybody's asking. That's what they're asking their doctors. That's what they're asking their teachers. That's what they're asking themselves. And it's not a clear-cut answer, as most families are learning. So to put it in context, right now it's the end of the first week in August, and Savannah and the surrounding areas, this is where we are, has a significant coronavirus problem. It is still quite high in terms of viral load. We are seeing on the news unfortunate illnesses in children, and it's a big question. So what's the position? Do we go to school or do we not go to school? And the answer is, it's not simple. The position of most pediatricians and the position of the American Academy of Pediatrics is that children belong in school as much as they can, as long as it's safe. So much happens in school that can't happen virtually. We learned this when everybody went virtual in March. They went home, they did Google Classroom, or they did WebEx or Zoom or whatever, and instruction did happen, but it wasn't the same as in person, especially for a child with Down syndrome or with other needs that can't be accommodated over a video screen. Without being in school, it's hard to learn without face-to-face interaction. You don't have hands-on therapies. You don't have hands-on special services. Some kids don't have a hot lunch without going to school. There's a lot to be said about going to school. So the magic question is, can we go back? Is it safe? Generically speaking, nobody knows your child better than you and your own pediatrician. So that's who you should go to for really good advice about what you should do. But in general, yes, a child should return to school, in person, if it's safe to do so. If they don't have a significant underlying medical condition, and if the school is going to provide a situation where the risk of coronavirus is reduced. It will never be 100% reduced. It won't be 100% reduced if you stay in your own home. You're going to have some interaction with the world. But in a school that does require masks, in a school that does require social distancing, in a school that does promote hand washing and temperature checks and keep them out if they're sick, that's a good situation to return to school if your child doesn't have comorbid, doesn't have other medical conditions to put them higher risk. Now, our families with a child with Down syndrome, there's a lot of risk. Not always. I mean, having Down syndrome by itself is not a risk, but many of our children have respiratory issues, asthma, other chronic lung diseases, immune deficiencies, other reasons where they would be higher risk. And many of our children with Down syndrome have older people living in the home. Now, John and I are not considered older. We're not going to share our ages, but older. Close. I'm not there yet. But older is a risk factor, and the fact is, kids do spread the disease. So having a child go to school and then come home and risk their caregiver getting ill is a reality. It's significant. It's a hard decision. It's not an easy decision. But if your child has no significant medical conditions and can return to a school setting that is as protected as can be, follows CDC AAP guidelines, and again, temperature checks, and yes, wearing a mask, I would consider it. Without those, then maybe a little bit longer going virtual might be the safer way to go. That did not give anybody any absolute answer. So I did not tell you one way or the other, because your child is different. Your school is different. Every situation, every family is different. So there's no one answer fits all. But in general, yes, returning to school if possible. Did I avoid the issue, Don? Did that help at all?
No, that was good. Well, my Laney is actually Dr. Ben is her her pediatrician. And, we had those same questions. We weren't sure. Lainey has a tendency to put her hands in her mouth when she gets nervous. It was difficult for her to wear a mask. And, due to the issues, my father just had a hip replacement 2 weeks ago, and we still go over and see them at a distance. We thought it was best that she stayed home. And for this semester, she's got a Chromebook and she's doing all virtual learning. We've had 2 days now where she's been in school, and, we're still working out the kinks and all with it. But, hopefully it's going to be a great thing for her.
And now at the same time, I don't want to get personal. Your boys who don't have Down syndrome, they are returning to school. They're in college. They're returning. They're going to be in a lower risk situation because they're responsible to wear their masks. I hope they're watching. Wear your masks. And they are lower risk because unfortunately they're not at home so much. They're not getting exposed to the older family members. So they're in a situation where the risk is low. So for them, it does make sense.
Yeah. Yeah. We, they even talked about staying home for the semester, and, again, they weighed the risks and they felt that they can get home, when they have to, but that they had to be at school for certain classes. They had labs that they had to be there for. And, for every family out there, they have to weigh the risks in their own situation. Have you had consults with families that have asked these specific questions?
Every patient, every day. Absolutely. Children with Down syndrome, children without Down syndrome, children with other needs of all sorts. Absolutely. Within my own family, yes. Within my own household, within my own siblings who live in Atlanta.
Right.
Absolutely. It's the question everybody's asking is, we had to get pulled out of school in March and the disease was here. Now we're going back to school in August and the disease is here. I mean, does that really make sense? And I don't know. I mean, we know more about the disease, but we don't have it under control. We understand how it's spread, but we're not all masking. We're not all doing the things to protect it. So there is no magic answer.
So let me ask you this question, the big what if. We've thought if, we let Lainey go to class and one of her classmates ends up having a positive test, what steps do you recommend as far as testing, as far as, that type of situation?
So that's a great question. So of course, the schools are going to have steps in place to notify families, and then pediatricians have protocols in place, and most pediatricians follow CDC guidelines. Here in Savannah, all of the pediatricians, not just my practice, we are on a weekly web call, and we compare between our practices to make sure everybody's following the same guidelines, everybody's following CDC AAP recommendations, everybody's using the same. So back to your question. So let's say your child is exposed. What is exposed? Most pediatricians will say exposed is at least 15 minutes of close contact without wearing a mask. That's very generic because that's not something that parents can measure. What do they know? They know there was a child in my child's class who tested positive. There was a child in my child's grade, and we don't know if they shared the same room at the same time, but they were in the same room during the day. There was a child on the other age sports team that shared the facility with my child. It's never going to be cut and dry, but we're going to be probably more aggressive than ever. And so who should be tested? Who should be tested? Anybody who has symptoms of coronavirus and not another diagnosis. Can you have two things at the same time? You can, but it's pretty rare. If you're diagnosed with a positive strep test, with a positive flu test, with a positive RSV test. It's unlikely you're also going to have coronavirus. You can, but it's pretty unlikely. So usually if you have a positive other test, another diagnosis, then you don't. But if you have symptoms of coronavirus and don't have a specific other diagnosis, you should be tested. As far as contact goes, and this is getting to your question, if somebody's had a positive defined contact with someone with coronavirus, they should get tested. But here's the kicker: when? People will call our office and say, we were exposed today to somebody with coronavirus. And here's what we know: even if you're exposed, and even if you're exposed to a point where you're going to catch it, you don't turn positive on your test right away. You don't turn positive the first day, the second day. When do you turn positive? So there's a lot of data, there's a lot of recommendations, but most pediatricians will tell you at least 72 hours before your test will turn positive, and up to 10 days before you get the most sensitivity out of your test. It's hard to tell somebody that they need to wait 10 days for their test. Most pediatricians in our area are using 5 days as standard. So if you're exposed to coronavirus, you should get tested at about day 5. And until day 5, you've got to quarantine. You've got to stay home. Now, you'll get tested sooner if you develop symptoms, but if you're asymptomatic and exposed, at least 5 days usually before your pediatrician will test you. Now, and I'm just rambling, so at some point stop me when you're ready for me to stop.
No, it's good.
Testing is not where we want it to be, but it's getting better. So right now, the state of testing in most places, whether you're going to Department of Public Health, going to a pediatric office, going to CVS, it's a send-out test. The send-out tests, at the worst of the season, we're taking 6, 7, 8 days to get results. That's hard. Hi, Brenda. Most tests are now coming back at about 2 to 3 to 4 days, which is better. But here's what's going to change the course of the disease. Many pediatricians, I speak for pediatricians, I speak with pediatricians, many primary care doctors are soon going to be hopefully getting point of care testing, immediate care testing. People are used to the 10-minute strep test, the 10-minute flu test, yes, the 10-minute coronavirus test. Most pediatricians who have been eagerly ordering and waiting for these tests should be seeing them in their offices in the next 1 to 2 weeks. I mean, like, they're finally coming about. So anytime now. So the hardest part with testing is telling people you have to quarantine until your tests are back. So back up on that.
When you say the hardest part, are you getting resistance or pushback from that when you're saying?
Not just resistance and pushback, but lack of follow through. When you tell somebody that if your child has symptoms of coronavirus,
and what are those symptoms?
There are so many, but fever, rash, diarrhea, upper respiratory distress. The more we learn about the disease, the more almost anything could be coronavirus, but specifically GI symptoms, respiratory symptoms, fever, rash, without another diagnosis.
And tragically, we had a young child that showed symptoms, and due to the fact that they were at home for a period of time.
I don't know if that's the case or not, but I did hear a child passed away recently, and it's not my patient. I don't know details, but whatever the case may be, it should remind people that this is a real disease for all ages. Not many children die of the disease. Most of the deaths are in the elderly. Most of the deaths are in the immune compromised or those with other conditions, but not always. This can happen in teenagers. This can happen in kids. It's not common, but I mean, even one is too many if it can be prevented. But I want to get back to the point on testing. That when somebody is tested for coronavirus because they have symptoms, they need to quarantine, and their entire household needs to quarantine until the test is back. And that's the hard part. When a parent comes in and their child is tested, and you tell them this, the test might not come back for 4 or 5 or 6 days, they'd have to realize their spouse, and their other children are all quarantined in the house. They immediately can no longer go to camp, go to sports, go to school, go to work. And that's been the hardest part of the disease. And when the child clinically gets better while you're still waiting for the test, a lot of parents will say, this is, I mean, I get it. This is pointless. My child is better. None of us are sick. why are we sitting in our house waiting for a test to come back up? That's unfortunate, but that's reality. So once we can have rapid testing, then we can definitively have people, I guess, a little bit more convinced that yes, this is coronavirus, and yes, you do need to quarantine for 10, 14, whatever the guidelines will be at the time.
And when did you say that you think the rapid testing will be available?
Most pediatricians any day now. I mean, in the next 1 to 2 to 3 weeks, there are at least 3 different types of, or different companies making tests, and maybe more. But most of those tests early in the disease only went to hospitals and nursing homes. And just in the last few weeks, it's been announced that they will be released to general pediatricians, primary care doctors. So I know here in Savannah, many pediatric offices are excited that these should be coming pretty soon.
So if someone comes to your office, you would you treat them like any patient, and do you bill for the test, or how is that administered typically?
Yes, it's billed right now. Every insurance is different, but right now, send-off testing is billed by the lab. We send it to LabCorp, Quest, whoever, and then the company bills it. If it's in our office, then it's a point of care, then we bill it for our office. But during coronavirus, during the pandemic, most insurances have been very, I don't want to use the word generous, but they've been paying for COVID care. They've been paying for telemedicine. They've been paying for coronavirus testing. They've been paying for things that are related. So yeah, the insurance companies in general have been very point on in terms of helping parents, helping families deal with coronavirus.
Very good. Yeah, because I know many of our families, their children have Medicaid because they can't get any other type of insurance a lot of times.
Oh,
And
sure.
so, you have to think about that billing. You hate for people to be scared off from getting testing if they're seeing symptoms and they don't, want to react.
Completely understand it, and I can tell you, in our practice and other practices in our area, there is nobody who has not been tested based on insurance problems. Even in the most dire situations, it's worked out. So, and if you get your test at DPH, Department of Public Health, it's free. If it's done in your doctor's office, it's almost always, it should be, covered by your insurance. So yeah, that's not, of all the problems we've had with coronavirus season, getting parents, getting families to have their care paid for has not been a problem.
Excellent.
It's not been a large problem.
Yeah. What can you speak to any about the vaccine that they're currently? I know some friends of mine that are on the
trials.
Are in the trials right now.
Yeah. Here's what I can speak to. I want it. We need it. People are asking already, are you going to have it? Are you going to give it? Do you believe in it? I would not even begin to comment on something that doesn't exist yet. In generic terms, if the vaccine is made, is proven effective, and is proven safe, then yes, we would absolutely be on board. But we would certainly not go ahead and blanketly say we approve, we are on board with a vaccine that doesn't exist yet. So absolutely, if it's proven safe, if it's proven effective, then based on that, yes, I think every pediatrician would recommend the vaccine. When is it coming? Which drug company is going to have it? I'll let you make that guess, John. But hopefully, I mean, everyone says by the end of the year. I'd be very happy if we saw it by the end of the year. I'd be more likely to think we would see it in the later winter, early spring, just based on if testing goes well, how long it takes to manufacture, how long it takes to get it out there. I think these things don't just happen overnight, but it'd be nice if it did. And on that, by the way, while we may not have a coronavirus vaccine right now, we will have a flu vaccine. We have it every single year. And the more flu we can drive down while coronavirus is surging, the better off we all are as a society. So when the new flu vaccine comes out, which is just a few weeks away, typically pediatricians get that in late August, early September. As soon as the new flu vaccine becomes available, you get your family vaccinated. Get it for yourself, get it for your children, get it for your grandparents, get it for everybody. Please get the flu vaccine when that comes out.
Have you seen any flu cases yet?
Not this season, no. We had a very heavy flu season coming at the end of winter, but typically in Savannah, flu dies down in the summer, and no, I've not seen cases in a few months. It was pretty heavy right before coronavirus hit. And unfortunate for our area, areas up north really had a lot of co-mingling at the same time. In the Savannah area, really flu died down right before coronavirus picked up. So, I mean, if anything, that's fortunate that we didn't have both at the same time. So no, we've not seen a lot of flu in our area yet. Typically, Savannah gets a decent surge of flu October, November, December, which is why we recommend everybody get their vaccine before then. You can't get your flu vaccine too early, but you can get it too late. So once it becomes available, please get it.
Yeah. Very good.
Yeah.
That's great information, because I read a statistic that like half of the people that can get the vaccination for the flu don't get it. So
it's sad. I think it'll be higher this year. I think people really understand the importance of preventive medicine and preventing disease, but we'll see.
Last question, or another question I have is,
Sure.
Do you have resources for people as well?
In terms of
the things that we're talking about, is there something that we can put on Facebook or on our webpage as well that people can go to for information as well?
Well, the gold standard, and of course I'm biased, is the American Academy of Pediatrics. In particular, their website, healthychildren.org, which is on Facebook, Instagram, whatever. But the American Academy of Pediatrics is the leader in terms of advice for all children, including children with Down syndrome. So the AAP has been very active in back to school planning and back to school advice in COVID understanding. So yeah, I absolutely, as we do for our own practice, I would point the group to the AAP.
And I would tell people that are watching this actually too, if you put a comment into your Facebook comments or the YouTube comments, Dr. Ben can come back and answer those questions. So if you do have one that has not been answered tonight or in this call, you can put them there and we can follow up and answer people's questions as well. So this has been excellent. Thank you so much. I know there's a lot of uneasiness, there
is a lot of uneasiness.
Yeah.
Can I give you one more thing that you did ask? I was waiting for, because here's the other. So we get 3 questions basically. Should my child go to school? Should we get tested for coronavirus? And the third one is, should we get antibody tested? So I wanted to touch on that real quick, because that's a very common question. The answer is not yet. But so in general, most people understand how diseases work, and they understand that your body, when it catches a disease, it builds antibodies. It builds protection to the disease. So in theory, in a perfect world, we should be able to test ourselves for coronavirus antibodies and thus assume that we have protection. We don't recommend this. Most pediatricians don't recommend this just yet for 2 reasons. One is the antibody tests that are commercially available are not fantastic. There's a very high false negative rate. False negative means that if you're tested and you do have antibodies, it actually says you don't. So that could say that, okay, so you're not protected, but it also could say you're actually sick and spreading it, and you'll get a false sense of, no, I'm not, because the test is negative. But the other is, it's not really proven yet that having antibodies to coronavirus is protective long term. And in fact, we are seeing now people who've had coronavirus catching it again. Is it a worse case the second time? Is it less worse the second time? We don't know. But they have shown that antibodies, and some people who have caught it, and some people who have tested positive for antibodies, their antibody level is decreasing over months with time. And the one thing we don't want is people to do an antibody test, find it comes back positive for antibodies, and then say, oh, I'm protected. I don't need to wear a mask. I don't need to follow social distancing. I can go and do whatever I want to do. No. People, even if you antibody tested positive, it's not proven protection. We want you to still follow all the social distancing guidelines, all the masking guidelines. So most pediatricians don't yet recommend antibody testing.
Interesting. Yeah.
Yeah.
Because I've had that same question that, if I have positive antibodies, then I don't have to worry about it. So
yeah, no, you do. And I've known many healthcare providers who have done the antibody test, and it tested negative. And most of them say, oh, I don't believe it. It must be a false negative. I know I had a bad case of it back in January. I had something that felt like the flu, and it wasn't the flu. It must have been. Let me tell you something. Most people who had an illness in our area in January, February that think it was coronavirus, it was not coronavirus. We were not circulating COVID in our area to any significant level in January, February. We can say we weren't testing. That's true. We weren't doing widespread testing, but we do know from surveillance that it really did not start picking up in our area at that point. So that's the other thing is like you said, if you tested negative, would you even believe it? So yeah, antibody testing, not yet.
Right. So lastly, so give us what we've heard these things over and over again, but if you have a child that's going to school, or even if you're a person that's going to work, what should we do to protect ourselves from the virus?
Okay, great question. The answer is wear a mask, wash your hands, practice social distancing. That is, stay in as smaller groups as possible, stay as distant as possible. 6 feet would be ideal. And the final thing, and this is going to be hard, is be honest with yourself and people around you when you are sick. So before coronavirus, most of us, all of us, went to work and went to school a little bit under the weather. It was not a big deal. I get it. There's pressures. I have patients to see. You have clients to see. Our kids have tests to take. And in the days before coronavirus, it was not a big deal to say, you know what, we're a little sick. I'm going to take some Tylenol and I'm going to go to work. I'm going to give my child a dose of Motrin and she's going to go to school. We're in a different world now. We need to be honest. And if our child and if ourselves are sick, go see your doctor, go get tested, go miss work, go miss school. The world has never been more understanding about missing school and missing work. And I know we put pressure on ourselves, and those pressures are real. I mean, people have been out of work for months, and every paycheck matters, and that I totally understand. But if we're going to beat the disease, if we're going to get this down, people need to be honest. And when they're sick and when they're potentially spreading coronavirus, they need to quarantine. They need to get tested. They need to get treated. They need to see the doctor. So wear a mask, wash your hands, social distance, and be honest. If you're sick, get care. Good
advice. I know there's controversy about wearing a mask and all, but everything shows that that's the number one way that this is spreading is through the air.
I know there's controversy. Pediatricians compare it to the time where there was controversy about seat belts. There was a time where there were no seat belts and we tried to get them put in, and people said, oh, I've been in an accident without a seat belt and I did fine, and I've not worn a seat belt for 20 years and I've done fine. And finally we realized that seat belts do protect lives, and it's not an exact comparison. Somebody's going to say it's not an exact comparison, but as we become accustomed to understanding how things protect us, eventually we do realize that some things are necessary for the greater good.
Right. Very good. Yeah. Well, thank you for your time. I greatly appreciate you taking some time out tonight to speak to our families and to our community, and just great information, and just to reinforce some of that stuff that we really need to think about during this time.
Well, it's great being on. I'm sorry it's like this, although I do like not wearing a mask. I wear a mask all day long, as do you. So it's nice to be able to talk to somebody. Yeah. I know it's nice to talk to somebody without a mask and goggles, but I look forward to this being over in months or longer. I miss our monthly LDSS, our Down syndrome meetings. I miss seeing all of our families. I miss seeing all the children together playing. So I look forward to this one day being behind us.
Yeah. One thing about all these pandemics that have ever happened in the past, they all disappeared.
That's right.
So we will get through this, but let's be smart. Well, thank you so much. Appreciate everybody being here tonight. If you have any questions, please follow up with questions in Facebook or YouTube, and Dr. Ben will get back and follow up with you as well. So everyone else, have a good night. Thank you, Dr. Ben. Appreciate your time. Stay safe. Bye-bye.
Bye-bye.